Before we learn how to save lives, we first learn how to survive our screens. You wake up to notifications. You open your phone before you even open your eyes. Group chats. Online meetings. Online requirements. Deadlines on the LMS, requirements posted in Canvas. As nursing students, technology is no longer optional. It is everywhere. It has become a necessity. But while technology helps us learn, it can also silently overwhelm us. The question is, does this digital pressure affect how confident we feel as future nurses? This inspired us to begin our study entitled Technostress and Self-Efficacy Among Nursing Students. Good day, everyone. I am Jewelyn L, Liberato, and along with me are my fellow researchers.
I am Shamel, Louise. I'm Matilla.
I am Kinneth Mercado.
I am Yoanna Migallos.
I am Josh Matthew Millevo.
Our research study aimed to determine the level of technostress and self-efficacy, and to identify whether a relationship exists between the two among nursing students. To answer this, we carefully designed our methodology.
The study used a quantitative descriptive correlational design to describe the population and determine the relationship between technostress and self-efficacy without establishing causation in a natural setting.
Next, let us take a look at who participated in the study. The study involved 295 first to fourth year nursing students enrolled during the second semester of academic year 2025 to 2026 in a local university. The sample size for this study was determined using the Cochrane's formula with a 95% confidence level, 0.5 estimated proportion, and 5% margin of error. Stratified random sampling with proportional representation per year level was used through a random number selection method.
Our research instrument, this study used a structured 4-part questionnaire that took 10 to 15 minutes to complete. Data were collected on-site and were handled with strict confidentiality. Part 1 included instructions and informed consent, while Part 2 gathered the demographic data. Technostress was measured using a standardized scale, which was the adapted Technostress scale by Upadhyaya and Brinda 2021 that covers 5 dimensions. This tool demonstrated strong reliability and validity with a KMO value of 0.88 and a Cronbach's alpha greater than 0.70. Self-efficacy was assessed using 3 modified standardized scales across 3 domains: the academic, clinical, and tech-related self-efficacy. Pilot testing showed excellent reliability with a Cronbach's alpha of 0.94, and the overall instrument validity score was 4.82, confirming the instrument's validity. All items were rated using 5-point Likert scale.
This section presents the results and discussion of the study, focusing on the demographic profile of the respondents. In terms of age, the highest group is 19 years old at 24.75%, while the lowest includes ages 26, 27, 28, 29, and 37 at 0.34% each. For sex, females are the majority at 71.86%, and males are the lowest at 28.14%. In year level, first-year students are the highest at 33.22%, while fourth-year students are the lowest at 17.63%. For screen time, 7 to 12 hours is the highest at 41.36%, while 1 to 2 hours is the lowest at 1.02%. Lastly, the most used devices are smartphone, tablet, and laptop or desktop at 27.46%, while the least used is the combination including monitor and projector at 0.34%.
For For the technostress level among nursing students, techno uncertainty has the highest mean of 3.66, interpreted as high, indicating that frequent changes and updates in technology are the most stressful for students. This is followed by techno overload with a mean of 3.07 and techno invasion with 2.80, both interpreted as moderate. Meanwhile, techno insecurity has a mean of 2.37 and techno complexity with 2.36, both interpreted as low, showing that students experience less stress in understanding technology and fear of being replaced by it. Overall, technostress as a whole has a mean of 2.85, interpreted as moderate.
Among the categories of self-efficacy, tech-related self-efficacy has the highest mean at 4.1737, academic self-efficacy has 4.1553, and clinical self-efficacy has the lowest mean at 3.9364, with all of these being interpreted as high mean scores. The level of self-efficacy taken as a whole is 4.0885, which is interpreted as a high mean score as well, showing that students believe in their own capabilities and are confident at completing tasks.
To answer the SOP number 4, the results of this study show a very weak negative correlation between technostress and self-efficacy. It shows a correlation coefficient of negative 0.0271 with a p-value of 0.491, indicating that technostress does not significantly affect nursing students' self-efficacy. This finding suggests that despite experiencing moderate levels of technostress, students are able to maintain high confidence in their academic, clinical, and tech-related skills.
Moving on to the conclusion, most of the nursing students in the study are 19 years old, are female, from level 1, have a screen time of 7 to 12 hours daily, and use a smartphone. Nursing students experience a moderate level of technostress, with techno uncertainty being experienced the most and techno complexity the least. Nursing students experience a high level of self-efficacy, with tech-related self-efficacy being the highest and clinical self-efficacy the lowest. There is no significant relationship between technostress and self-efficacy. The high self-efficacy of students combats the effects of technostress. This suggests that students' confidence in their abilities helps them cope with technological challenges in their learning environment.
Based on these findings, we propose the following recommendations. For healthcare administrators, it is recommended to provide clear and consistent technology guidelines for students. For schools and academic institutions, it is recommended to maintain stable learning platforms and strengthen digital skills training. For educators, it is recommended that there should be the use of hands-on, student-centered strategies and simulations, as well as guide practice with digital tools. For counselors, it is recommended to promote stress management and healthy technology habits. For student nurses, it is important to develop adaptability to technology, maintain a balance between screen time and skill practice, and continuously build clinical competence alongside digital competence. For future researchers, you may explore this study in other institutions or regions.
For our references, you may scan the link as reflected on the screen.
As we end, we would like to leave you with a quote: "Technology is here to stay, and so is nursing." As future nurses, we must learn not only how to use technology, but how to care through it. Let this remind us to continue to combine skill, compassion, and adaptability in our practice as future nurses. Because at the end of the day, patients may see the machines and technology, but they will always feel the nurse behind them. And no amount of technology can replace the confidence, competence, and compassion of nurses who believe in themselves. Thank you, and once again, this is BSN 3F Group 2B.